Welcome to Statistically Speaking with Dr. E. Today we are going to take a deep and structured look at how big data is transforming healthcare systems, clinical decision making, public health practice, and biomedical research. We will also critically examine the statistical, ethical, and security challenges that arise when we integrate massive, complex, and sensitive data sets into healthcare environments. Our goal today is not just to describe what is happening, but to understand how and why it is happening, what the statistical implications are, and what responsibilities we carry as data scientists and statisticians working in this space. Let us begin with a fundamental question. What do we actually mean by big data in healthcare? In data science, big data is commonly described using three core dimensions: volume, velocity, and variety. Volume refers to the extremely large scale of modern datasets. In healthcare, we are no longer talking about thousands or even hundreds of thousands of records. We are now dealing with millions, and in many systems, billions of observations collected across hospitals, clinics, insurance systems, laboratories, and digital health platforms. Velocity refers to the speed at which data is generated and processed. Unlike traditional datasets that were static or updated periodically, healthcare data today is often generated in real time. For example, intensive care units continuously stream patient vital signs. Wearable devices record heart rate variability, sleep cycles, and physical activity minute by minute. Emergency departments generate high-frequency operational data that must be processed immediately to support decision-making. Variety refers to the diversity of data types and sources. Healthcare data is no longer limited to structured numerical fields in a spreadsheet. It now includes structured data, such as laboratory results and billing codes, semi-structured data, such as clinical notes, and unstructured data, such as medical images, physician narratives, and even audio recordings of patient interactions. This combination of volume, velocity, and variety creates what we describe in statistics as a high-dimensional, heterogeneous, and noisy data environment. This is both an opportunity and a methodological challenge, particularly when we consider issues such as missingness, measurement error, and distributional heterogeneity. To understand the scope of healthcare data, we need to identify its major sources. Electronic health records are one of the most central components. These systems contain longitudinal patient histories, including diagnosis, prescriptions, lab tests, procedures, and clinical notes. They provide rich temporal structure, but they are also prone to inconsistencies, coding variability, and missing data. Medical imaging represents another critical source. Technologies such as magnetic resonance imaging and computed tomography produce extremely high-dimensional data. Each image can contain millions of pixels or voxels, and advanced imaging modalities generate complex three-dimensional structures that require sophisticated computational methods for analysis. Genomic data adds another layer of complexity. Sequencing technologies generate massive datasets that capture genetic variation at the molecular level. This introduces statistical challenges related to multiple testing, high dimensionality, and the interpretation of biological significance. Wearable technologies, including smartwatches and fitness trackers, continuously generate physiological and behavioral data. These devices provide fine-grained temporal resolution, but they also introduce measurement variability and issues of external validity. Finally, we must consider social determinants of health. These include income, education, occupation, housing conditions, and environmental exposure. These variables are often not collected in traditional clinical systems, yet they are essential for understanding population health and health disparity. When combined, These sources produce datasets that are not only large, but also structurally complex and often incomplete. This creates a significant challenge for statistical modeling, particularly in terms of integration and harmonization. Now let us move to the impact of big data on medical practice. Traditionally, medicine has relied on a relatively standardized approach to treatment. Patients with similar diagnosis often receive similar interventions, with adjustments made based on clinical judgment and experience. However, big data is driving a transition toward precision medicine. Precision medicine aims to tailor treatment strategies to the individual characteristics of each patient, including genetic profile, behavioral patterns, environmental exposure, and prior treatment response. To illustrate this, consider two patients diagnosed with type 2 diabetes. Under traditional approaches, both patients might receive the same medication protocol. However, with access to comprehensive data, we can differentiate between them in meaningful ways. One patient may respond better to a specific medication due to genetic markers affecting insulin sensitivity. Another patient may require a different intervention based on lifestyle factors such as physical activity and dietary habits. A third patient may have comorbid conditions that influence drug interactions and treatment effectiveness. From a statistical perspective, this shift represents a move from population average estimation toward individualized prediction. Instead of estimating a single treatment effect for all patients, we are increasingly interested in heterogeneous treatment effects and personalized risk profiles. A major application of big data in healthcare is predictive analytics. Predictive modeling allows healthcare systems to estimate the probability of future events based on historical and real-time data. These models can be used to predict disease onset, hospital readmission, treatment response, and patient deterioration. Machine learning techniques are particularly important in this context. Algorithms such as logistic regression, random forests, gradient boosting machines, and deep neural networks are commonly used to model complex nonlinear relationships in healthcare data. One particularly impactful application is early warning systems in hospitals. For example, predictive models can identify patients at risk of developing sepsis hours before clinical symptoms become severe. This allows clinicians to intervene earlier, potentially reducing mortality and improving outcomes. From a statistical standpoint, these models rely heavily on feature engineering, temporal modeling, and validation techniques such as cross-validation and external validation to ensure generalizability. Big data also plays a significant role in public health and epidemiology. Real-time data streams enable public health agencies to monitor disease outbreaks as they emerge. This was particularly evident during global pandemics, where data from hospitals, laboratories, and mobility patterns were used to track transmission dynamics. Epidemiological models, such as compartmental models, can be combined with real-world data to estimate infection rates, reproduction numbers, and intervention effectiveness. In addition, big data supports resource allocation and health system planning. By analyzing admission trends and patient flow, hospitals can optimize staffing levels, reduce bottlenecks, and improve bed utilization. Queuing theory and time series forecasting are often used in this context to model system demand and capacity. Despite these benefits, big data in healthcare introduces significant risks, particularly in the area of privacy. Healthcare data is among the most sensitive types of personal information. It includes not only clinical conditions, but also genetic information, mental health records, and behavioral patterns. A key concern is the risk of re-identification. Even when datasets are anonymized by removing direct identifiers, individuals can sometimes be re-identified by linking multiple datasets together. This is especially true when high-dimensional data is involved, as unique combinations of attributes can act as quasi-identifiers. To address this issue, statistical privacy techniques are used. Data masking, aggregation, and suppression are common methods. More advanced approaches include differential privacy, which introduces carefully calibrated noise into datasets to protect individual level information while preserving aggregate statistical properties. Cybersecurity is another major concern in healthcare systems. Healthcare databases are high-value targets for cyber attacks due to the sensitivity and financial value of the information they contain. Data breaches can result in identity theft, financial fraud, and erosion of public trust in healthcare institutions. To mitigate these risks, healthcare organizations implement multiple layers of security. These include encryption of data at rest and in transit, multi-factor authentication for system access, role-based access control, and continuous network monitoring for anomalous activity. However, even with these measures, no system is completely immune to attack. This makes cybersecurity not just a technical issue, but an ongoing operational and governance challenge. Ethical issues are deeply embedded in the use of big data in healthcare. One of the central ethical concerns is informed consent. In many cases, patients provide consent for data collection during treatment, but they may not fully understand how their data will be used in secondary contexts, such as research, commercial analytics, or algorithm development. This raises questions about autonomy and transparency. It also raises concerns about data ownership and control. Another major ethical issue is bias. If training data is not representative of the population, predictive models can produce systematically biased outcomes. This can lead to disparities in diagnosis, treatment recommendations, and access to care. From a statistical perspective, this involves issues of sampling bias, selection bias, and measurement bias. Addressing these requires careful dataset design, model evaluation across subgroups, and fairness-aware machine learning techniques. While machine learning offers remarkable opportunities in healthcare, its true value lies in how responsibly we use it. On the promise side, machine learning supports personalized medicine, allowing predictions and treatments to be tailored to the individual patient rather than relying only on population averages. This shift can significantly improve treatment effectiveness. It also enables early detection, where predictive models identify risks before symptoms become severe, giving clinicians the chance to intervene proactively and improve outcomes. However, these benefits come with important ethical and practical challenges. First, privacy and security are essential. Healthcare data are among the most sensitive forms of information, so anonymization, encryption, and informed consent must be rigorously maintained. Second, algorithmic fairness cannot be overlooked. A model that performs well overall may still disadvantage certain demographic groups if it is not carefully validated. This is why fairness metrics, subgroup performance checks, and bias assessments are non-negotiable. So the goal is not simply building accurate models, it is building trustworthy, equitable, and secure systems that balance innovation with responsibility. The regulatory environment provides an important but incomplete layer of protection. In the United States, the Health Insurance Portability and Accountability Act establishes standards for the protection of health information. It defines requirements for confidentiality, integrity, and availability of protected health information. However, HIPAA was designed before the emergence of modern big data ecosystems. It does not fully address challenges such as cloud-based data storage, artificial intelligence applications, third-party data sharing, or data generated by wearable devices. As a result, there is a growing gap between technological capability and regulatory coverage. This gap is often described as regulatory lag, and it presents significant challenges for policymakers and practitioners. To address these challenges, several technological solutions have emerged. Encryption is a foundational tool for data protection. Advanced cryptographic techniques ensure that even if data is intercepted, it cannot be interpreted without the appropriate decryption keys. Homomorphic encryption represents a particularly advanced approach. It allows computations to be performed directly on encrypted data, producing results that remain encrypted until they are decrypted by authorized parties. This enables secure computation in untrusted environments. Blockchain technology offers another approach by providing decentralized and tamper-resistant data storage. It creates immutable records of transactions and ensures transparency in data access and modification. Differential privacy, as previously mentioned, provides a statistical framework for protecting individual level information while enabling meaningful aggregate analysis. Artificial intelligence introduces both opportunities and risks. While it can significantly improve diagnostic accuracy and operational efficiency, it must be designed with transparency, accountability, and fairness. Explainable AI methods, bias auditing, and ethical review processes are essential components of responsible AI deployment. To illustrate these issues, consider a hospital that develops a machine learning model to predict patient no-shows for scheduled appointments. The model uses variables such as prior attendance history, demographic characteristics, and distance from the hospital. The goal is to improve scheduling efficiency and reduce missed appointments. While the model may improve operational performance, it raises important ethical questions. If certain socioeconomic variables are strongly associated with missed appointments, the model may disproportionately flag low-income patients as high risk. This could inadvertently reinforce existing inequalities in healthcare access. This example highlights the importance of statistical oversight, fairness evaluation, and ethical review in applied machine learning systems. Statistical oversight is crucial in AI healthcare applications. When AI uses socioeconomic factors to flag patients, it raises concerns about algorithmic fairness. Oversight ensures models serve all patients equitably, preventing technology from amplifying existing inequalities. Ultimately, addressing big data in healthcare requires a comprehensive and integrated approach. This includes updating regulatory frameworks to reflect modern technologies, implementing robust technical safeguards, and embedding ethical principles into every stage of the data lifecycle. It is not sufficient to rely on any single solution. Instead, we need coordination between policy, technology, and statistical practice. Now, let me speak directly to you. As graduate students and future data scientists, you are central to this field. You are responsible for ensuring data quality, conducting rigorous model validation, and communicating uncertainty in a clear and transparent manner. You are also responsible for maintaining ethical standards in your analytical decisions. It is essential to recognize that not all data that can be analyzed should be analyzed without careful consideration of context, consent, and potential consequences. Responsible data science requires reflection on the purpose and impact of analysis, not just technical execution. Analyzing data indiscriminately can lead to ethical dilemmas and privacy concerns. It's crucial to evaluate the necessity and implications of data analysis before proceeding. Responsible data use ensures respect for individual rights and societal norms. Balancing innovation and ethics is crucial. Big data has the potential to improve health outcomes, but this is contingent on the right conditions being met. Ethical considerations must guide the use of data to ensure it benefits society without compromising individual rights. Addressing big data in healthcare requires a societal approach. It's not just a technical issue, Policymakers, practitioners, and all stakeholders must collaborate to find the solutions. Big data in healthcare promises transformative benefits. It enables earlier and more accurate disease diagnosis, offers personalized treatments tailored to individual patients, and enhances public health outcomes by providing population-level insights for systemic improvements. However, these benefits come with significant risks, including privacy risks, as sensitive health data is vulnerable to misuse or breaches. Ethical dilemmas, including bias, consent, and fairness, require ongoing vigilance. Additionally, healthcare systems face significant security vulnerabilities, making them prime targets for attacks. The future of healthcare hinges on balancing innovation with responsibility. As statisticians and data scientists, our leadership must embody integrity, rigor, and responsibility. These principles guide us in navigating the complexities of healthcare data, ensuring ethical and effective advancements. Our work transcends data analysis. It directly impacts human lives. Every decision we make as statisticians and data scientists carries significant ethical responsibility. We must prioritize the well-being of individuals in our analysis and interpretations. If you found this video helpful, don't forget to like, subscribe, and click the bell to stay updated on all things data and statistics. Thanks for watching.